Hi, I'm JP Miller of the Empire Report. I am so excited to be hosting this legislative live stream on nursing homes sponsored by AARP New York. The big question we all have is whether New York's nursing homes and adult care facilities are ready for a potential second wave of COVID-19 this fall. We have New York's top healthcare focused legislators and AARP leaders to discuss today. Our panel today is moderated by Errol Lewis. Everyone knows Errol. He is political anchor of New York One News, host of Inside City Hall, CNN contributor, columnist, and overall amazing guy. Errol will be joined by Senate Health Committee Chair Gustavo Rivera, Assembly Health Committee Chair Dick Gottfried, Assembly Member Ron Kim, Bill Ferris, AARP New York's legislative representative, and Richard Malott, executive director of the Long-Term Care Community Coalition. This is JP Miller. Thank you for joining us today for Empire Report's State of Nursing Home panel discussion. I leave you now with Beth Finkel, State Director of AARP New York, to provide opening remarks and welcome. Beth, take it away.
Thank you so much, JP and the Empire Report, for hosting this vodcast. And thanks to all our participants for joining this important discussion about the state of New York State's nursing homes, adult care facilities, and home care. We at AARP New York want to make conditions the best they can possibly be for residents, for workers, and for home care recipients, and to learn from what has happened during this pandemic so far. I'm sure all of our panelists agree. We appreciate the steps the state has taken to improve conditions at nursing homes, but AARP New York thinks so much more should be done. So let's jump right into the discussion and let's see what we can do. And who better to turn it over to than our moderator, the host of New York One's Inside City Hall program. And really, I think we all agree, one of this state's most talented and experienced political reporters, Errol Lewis. Thank you, Errol.
Thanks so much for that introduction, Beth. Thank you for putting this together, JP. I want to make sure that we understand this is going to live on. And so a lot of people won't be watching right now, but there's a lot of stuff to talk about in the right now. And so panelists, you just completed over 20 hours of hearings on nursing homes and other adult care facilities. You heard from the Commissioner of Health. You heard from nursing home executives, union members, consumer organizations, families also testified. I wanted to go around briefly and get your thoughts on the state of nursing homes in New York generally, and in particular, do you think we need an independent review of what happened at the height of the pandemic and going forward so that we can figure out what went right and what needs to be changed? And I want to start with you, Senator Rivera.
Thanks a lot for Errol for hosting, well, obviously Empire Report for hosting this AARP, and thank you, Errol, for being the main the convener here. So I'll say we did over 20 hours. The main thing that we know is that there's a lot of information that we still don't have. It is unfortunate and sad, but the health department was not very clear with us in some of the information that we need to have, particularly around how many folks actually died who are nursing home patients who were then discharged to hospitals. And we need to have that information because we need to be able to make better policy. But the hearings were always about accountability first, and second, making good policy for the future. So I know that there's many nursing homes that were in crisis even before the crisis. That's something that I've said plenty about, certainly the communities where it has impacted the worst, where COVID-19 has impacted us the worst. There's still a lot of information that we need to gather to make better policy for the future. I'm glad that we got it started, but we still have a long way to go.
Okay. Assemblyman Gottfried, what were your impressions?
Well, I think we certainly do need an independent review, not only of nursing homes, but of our whole response and preparedness, or lack of preparedness, for the epidemic. I think the question is not so much, are our nursing homes ready for a second wave? I think it's pretty clear our nursing homes are not ready for just ordinary times, whatever ordinary means. I think it's clear that we have long had serious deficiencies in staffing in our nursing homes, in quality and health regulation enforcement by the health department in funding of nursing homes, which is primarily through the Medicaid program, which in turn demonstrates, I think, the need for a change in our tax policy to get a lot more revenue out of very high wealth in New York. And finally, I think we need to take a look at the question of for-profit ownership of nursing homes and whether we should be allowing that at all. You know, it used to be a minority of our nursing homes were for-profit. They have gradually taken over more and more nonprofit nursing homes. They're now a solid majority. And I think it's clear that there are serious quality deficiencies with for-profit ownership, and it siphons off a lot of money that ought to be going to take care of nursing home residents. So we've got a lot.
I was a little surprised as I began to look into this to find out that a majority, certainly a majority across the country and in New York State, of these facilities are for profit. And Senator, do you think that has an impact on the performance, the accountability, the regulation?
Look, I think there's a conversation that Dick and myself have been at the forefront of for the last couple of years related to just reconsidering how our entire healthcare system is organized. We are both sponsors of the New York Health Act, which starts on the premise that healthcare is a human right and that therefore we should not have a profit-driven system. So I certainly think that there's serious questions to ask when there's a profit motive. And ultimately, listen, if you have, my concern has always been for most of my constituents, whether they're served by nonprofit or for-profit entities, are all mostly Medicaid patients. We need to look at how Medicaid is underfunding many of these institutions, because many of the best actors, and we're talking about nonprofit entities who were trying their best to do what they could with the population that they had. We're not talking about the bad actors. The good actors were already in a problem, because if they have most of their patients from Medicaid and Medicaid is reimbursed at such a low rate, it just means that they're not going to be able to do the things that we need for them to do in times of crisis. So this entire system certainly we need to look very deeply at it. Okay.
Assemblyman Kim, let me bring you into the conversation. Many of us saw the coverage of your personal experience in trying to deal with problems with getting to loved ones, ensuring that their care was adequate at the height of the pandemic. After the hearings and the aftermath of the tragedy that befell your family, well, what's your sense of whether or not we need independent investigation of what has happened?
Yeah, thank you, Errol. You know, by not seizing this moment to expose every single thing that is wrong with our long-term residential facilities and nursing homes, and then implement real solutions to fix them, we are creating impossible situations for working families that need to take care of their elderly. You know, my journey started in this space with the woman named Berna Lee back in April. You know, she's a working class woman that has her mother in a nursing home in my district in Flushing, and she traveled all the way from Boston, where she works, to get basic answers in the middle of April. What's going on with my mom? I can't get in touch with her. I used to communicate with her every single day. I'm hearing rumors about COVID patients getting transferred into this nursing home. And I was there on the ground trying to get answers from the director. And the director is yelling at Berna that you have no right to be here. Get out of here. Just being angry at the family member. And I'm bringing this story up because there are thousands and thousands of, if not hundreds of thousands of other working families who are still stuck in similar situations. And to continue what Dick, Gottfried, and Gustavo was saying, it is a problem when 64% of New York State's nursing homes are for-profit driven facilities. We need to figure out how to make sure that the benefit systems that are fundamentally designed to create these secondary markets that are rewarding these for-profits that are vertically integrated and that are part of chain enterprises that have heavy private equity investments, and if they only exist in profit if they are hyper scaled. And we need to have these honest and tough conversations how to bring meaningful transformation in this space. So to make sure that the people who are still stuck in nursing homes could have their justice moving forward.
Okay, and thank you for sharing that with us. Richard Mollett, I know that these concerns are not new to the long-term care coalition. What's your sense of, or did you learn anything from these hearings that you didn't already know, or was this sort of re-emphasizing things that you've been advocating for a long time?
Well, largely, I would say it re-emphasized what I've known for a long time. But I think hearing, especially from the care staff, hearing from family members, was moving and profoundly informative. So I did learn from that. I would say, in regard to the idea of a study, we absolutely need further study. We probably need a couple of studies. We need a good academic study looking really at what went on in nursing homes. I know we're going to talk about data, but we obviously need good data to do that as well. And then we also need an assessment of, I think, as the Assemblyman and as the Senator is saying, we need an assessment of nursing home finances. We need to know where is the money that we're going, that we're spending through Medicaid and through Medicare, and where it's going and what we're getting in return. And that's really critical for moving forward.
And to the extent that you were testifying about these issues, do you think you were heard by the legislature? Do you have a sense of whether or not folks are prepared to move on your suggestions?
I think it's very much the beginning. So we've thankfully had a good relationships over the years with people who are concerned about nursing home care and about care for seniors and care for people who are disabled in adult care facilities over the years. But hopefully we have a broader audience among the legislators now, as people see that it's been a disaster. And as Assemblymember Gottfried said, the underpinnings, the weaknesses in the system have existed for a long time, and they were essentially just exacerbated during COVID-19. So hopefully more people will recognize that, but we'll have to see.
Bill Ferris, how did you and AARP, how did you, and at what point did you come to realize that there was a serious problem here? There's so much we learned about COVID along the way. Different people discovered the extent of the problem and where it was most troubling at different times. Was it March? Was it April? When did you start to hear that there were serious problems in long-term care facilities?
Well, we started hearing about it very early on, and hats off to Assemblyman Kim for really pushing this issue of communications between the facilities with the families. You were out there very early on that, Assemblyman, so thank you. But as far as the hearings, Errol, AARP never ever wants to see this happen again. This can never happen again. And hats off to the two health chairs, Senator Rivera and Assemblyman Gottfried. The stories that came out during that hearing of family members, of staff people not having enough PPE, A to Z. It just, I can't emphasize enough that we here in New York State, as advocates, as elected, the elected officials here today, this cannot happen again, and we must take every measure to make sure it doesn't happen again. And I think the question about an independent review of the nursing homes and what had transpired during the pandemic, AARP supports 100%. I don't think it should be finger pointing and say you're wrong and he's wrong and she's wrong. It should be more of what went wrong. Let's never let it happen again, and let's move forward with a plan in case we have another pandemic. And I agree with the discussion. There were a lot of issues beforehand, and I think COVID-19 really has exposed not only a lot of things in our society that had weaknesses, but COVID-19 definitely exposed problems that we have in our nursing homes.
As far as you're concerned, and I'll ask the same question of Richard Mollett, were people acting in good faith? This is a question that kind of came up fairly early on. You've got for-profit companies that are running these facilities. Some of these questions about being prepared with PPE, with trained personnel, with financial reserves if necessary, these are things that are frankly their responsibility, with or without legislation, with or without regulation. When they came to the hearing and when the industry says, look, we did the best we could with what we had, Do you accept that at face value?
I guess I'll go first. They have a responsibility, and I know we have some experts with Senator Rivera and Assemblyman Godfrey. There is an expectation, and I believe it's in New York law, that they have to take care of people that are in their care. And they have to do this. If they weren't prepared to do it, they needed to tell the Department of Health that they can't handle the situation, that they need help. But also, there wasn't really a focus on helping nursing homes early in the pandemic. I mean, there was a big focus on hospitals.
Yep.
And I'm not saying that was a bad thing. I mean, we needed beds, we needed the care for people when they went into the hospital. But ARP early on said that, yes, focus on the hospitals, but in the same breath, focus on nursing homes, because this whole thing struck and killed people first in a nursing home in Washington State. And we should heed that. And we should make sure that nursing homes and the long-term care system is part of the discussion as we prepare the hospitals.
Mm-hmm.
Richard, what's your sense of why perhaps folks weren't as prepared as they could have been?
Well, I think just what Bill is saying, that we didn't heed that. We didn't really heed that at all. And that's something, we had certainly seen Washington State first in this country, but we saw in China, we saw in Italy, we saw in Spain that senior facilities were hit hardest, seniors, elderly people were hit hardest. This shouldn't have been a surprise to anybody. And nursing homes, they're not hospital units, they're not MASH units in a war zone. They are residential care facilities for the most vulnerable people to the coronavirus. And I think that I do think we heard some really, frankly, wonderful stories from nursing homes, and I was really glad to see that. But for the most part, I think what the industry representatives were saying, they're paid lobbyists, obviously, for the industry, was not in good faith. And we saw, and have still seeing, I should say, a lot of people who are suffering and dying alone, failure to thrive, suffering from neglect, and of course, suffering with COVID-19. And it's an ongoing problem.
Okay. In fact, that brings up this question. I'd love all of the lawmakers to weigh in on this, especially. Nursing homes were granted broad legal immunity in the state budget. That was back in April. It was retroactive to the beginning of the pandemic, meaning that families of residents who died from COVID were effectively stripped of the right to sue for abuse or neglect or other misconduct. The state just repealed this immunity, but only for non-COVID care, and only going forward. So I guess the question for the lawmakers is, does this go far enough? And if not, is there a legislative fix being considered? And let me start with you, Assemblyman Kim.
Yes, we still have a bill that fully repeals. Chairman Godfrey and I both sponsored this repeal bill. And our thinking and approach was that if you want to talk about legal and criminal immunity, let's do it openly, and perhaps after the pandemic is over, with all the families, workers, and residents participating. Now, what they did was snuck in the governor's provision for this immunity in April 2nd in our budget. That went retroactive to March 7th for COVID and non-COVID treatments. So this means that if you went to the hospital back in March and you thought you had fundamental rights as a patient, those rights were taken away from you retroactively. So we don't think this provision that this repeal that we did goes far enough, because it doesn't go retroactive to fix the problems that we created for so many of our patients and residents whose rights were taken away retroactively. And also, what does this say about an industry that instead they were warned about the nursing homes, like everyone has said, and CDC issued a letter back in February to every single nursing home about what's about to happen to this country. Instead of lobbying the lawmakers, instead of going to the governor and fighting for every dollar to purchase PPE early and distribute them early on, they signed off on a blanket legal immunity, disincentivizing some of these for-profits to invest more to make sure that every facility had enough PPE.
Either of the chairmen.
Yeah, I think the immunity legislation was an abomination, is still an abomination, utterly unnecessary, because our legal system, both civil and criminal, has always accommodated things that people need to do because of an emergency. when nursing home patients were being evacuated from nursing homes and moved to other nursing homes because of Hurricane Sandy, nobody, got accused of anything because some of the patients got wet from the rain when they were being moved from here to there because it had to be done. It's to say that we needed this immunity statute is just absurd. And to say that you can't hold somebody either responsible by putting a violation on them or by suing them, that you can't hold them responsible unless you can prove that there was intentional wrongdoing or gross negligence is just inexcusable. It's good that we cut back on it so that it only applies to COVID care. Half a loaf is better than none. But even having this concept apply to people who are providing COVID care, to me, is inexcusable and should be fully repealed.
And I'll say briefly that there's many of us who voted against the budget. I'll remind you on this and many other issues that the budget, this is the same budget where the governor cut Medicaid during a pandemic and did not raise taxes on millionaires and billionaires, which we all realize we need revenue to be able to make sure that services that are basic to the most vulnerable not get cut. But the point that the Assemblymember Kim made at the beginning is absolutely essential, and that is about transparency. It is unfortunate and sad, although not surprising, that this administration continues to operate in a way, particularly with the added level of power that was given to them in the beginning of March. Another thing that many of us voted against, myself included, to give extra power to the governor. Well, there's a lot of things that happened without legislative involvement. And the fact is that on this particular issue, on the immunity, many of us didn't even know that this particular level of immunity was included until we saw the budget itself. And apparently they were worried. Apparently the governor was worried too much about putting those types of things in secret and writing his own memoir, as he is apparently taking a victory lap already, even though we're not even halfway done through the crisis. So I stand with my colleagues on this.
So now, Senator, what do you think accounts for that? How did the immunity find its way into the legislation, as best you can tell?
Well, as I said earlier, the fact is that the governor has consistently, during his entire tenure, but particularly in this crisis, has focused on doing things without legislative involvement. There is, as many folks might remember, at the beginning of the pandemic, when many of us, including the Chairman Gottfried and myself, believed that he had enough authority to deal with the crisis, he asked for more. Many of my colleagues sadly gave him that authority, which means that during the budget and since then, he has had the ability to do things without much legislative involvement. So whether it was on this issue or on many others, he loves to operate in the dark and then paint it in the best light possible when we know, again, he's too worried about his own image as opposed to actually getting good things done.
Well, Richard Mollett, as far as you're concerned, do we need a full repeal of the immunity that was granted?
Absolutely. And for the reasons that Assemblymember Gottfried said, if someone is acting appropriately under the circumstances, they don't have to worry about being sued. We are so concerned that nursing home residents have never been more vulnerable, as we've been talking about, and as I'm sure everyone in the audience knows at this time. And the inspectors are not going in, families are not going in, long-term care ombudsmen are not going in. The only potential accountability for any kind of abuse or neglect, including causing someone's death, is the specter of possibly having a lawsuit, and now that's gone too. So it's really, it's an abomination, as Assemblymember Gottfried said, and I agree with that.
Bill Ferris, we have a litigious society, but in the end, it is one of the accepted ways or one of the checks or regulatory formats that are out there in order to hold different groups, corporations, or industries accountable. Does the repeal you've seen so far go far enough?
From ARP's perspective, no, it has not. We agree it should be retroactive. It should be a full repeal of the immunity. And you're exactly right, Errol. You basically took away a tool, a very powerful tool, something to hold a nursing home or others accountable for their actions. That was taken away from close to 6,400 families if they wanted to see what happened when their loved one died. You just, when ARP found that was in the budget, it was unbelievable to us that was in there. And, as I said, we believe that it should be repealed and go back retroactively. and we support the legislation that was that Assemblyman Kim and Assemblyman Gottfried mentioned.
Let me ask the entire panel, anybody who might want to weigh in on this. There's been speculation that the immunity was placed there in part because the industry has made a lot of donations to various officials. This is an old question, an old problem, or an old challenge, we could call it, in Albany. Was any of that present, as far as anybody can tell?
I don't, when things like this happen, it's not like a group of lobbyists went to the governor and said, we'll give you $100,000 for your campaign if you'll do X. No one has to be that crude. Governors, legislators all know what interest groups are big contributors and have troops that they can put out on the street in a campaign. And a lot of the interest groups that were behind the community have always had that kind of influence. And I think, that showed up here. But I think also things like that don't happen unless people in power let them happen. And this happened because the governor in New York has excessive power in the legislative process, in the budget process. A lot of us have been trying to change that. And with that extraordinary power in the budget process, the governor was able to pretty much single-handedly force this on the legislature.
And if I may make a quick plug here, this is precisely why, and I know this is not necessarily what we're talking about, but a fully publicly financed system, campaign system, is absolutely essential, because either you have bad actors and legislators who will wait for somebody to give them a contribution to do a certain thing, or there's the perception that we only do things because people are giving us money. So this is why fully public financed campaigns, I have always argued for it and always will.
Okay.
And Errol, it was pretty clear in our hearings when we cross-examined some of the industry lobbyists that they had submitted drafts of the immunity, which was taken upon by the governor. And I agree with my colleagues that, at a time of crisis, it's clear that the executive didn't turn to AARP, didn't turn to Richard Mullet, or didn't turn to any of the families or advocates, but they turned to the industry lobbyists and special interest groups to co-design the solutions. And that's not good enough moving forward.
Okay. A chapter we will probably not see in the forthcoming book. Let me switch topics. I want to ask, Mr. Mullet.
If you don't mind, I just wanted to add one thing. You had mentioned about people being litigious, and that may be true, society-wise. But in terms of nursing homes, families rarely sue. And we talk to families a lot, and I've been at this for close to 20 years. I've been a family member myself and seen neglect and abuse. People don't want to, first of all, if their loved one is still in the facility, they're afraid of retribution. They're afraid it'll be taken out in one way or another against their residents, so they often don't complain, no matter sue. And then if their resident dies, even if the resident is killed because of a lack of care or of abuse, they don't want to relive it. They don't want to think about their loved one suffering. They don't want to think that something more could have been done. And so I just wanted to clarify that it really is the rare person who is so upset and so angry, and on top of that is able and willing to see it through into a lawsuit. But even though it's small, it's still important, because there is that specter, at least the possibility, when there is abject neglect or abuse. So I just wanted to clarify that line.
Okay, no, thank you very much for that. Let me switch topics. Folks, we've seen 6,500 people at least die from COVID-19 in New York nursing homes during the pandemic so far. There's been a lot of controversy over the fact that the state health department has not provided information about how many more might be included on that list. But they were transferred to a hospital, and if they died in the hospital, the number wasn't necessarily included with the long-term care facilities. Are they tracking the data at all? And do you expect us to get the data? Is there anything more that they can and should be disclosing to the public? Let me start with you, Mr. Mullet.
Well, I don't know what, I can't say what the department is tracking, but I think it's absolutely critical that we have data from January 1st on both cases, suspected cases, deaths, suspected deaths, and perhaps most importantly, what went on when someone left the facility. If someone died outside of a facility, we need to know that we really, we talked about studies which are critical both for recognizing the people who passed and for making sure it doesn't happen again. We cannot do that without adequate information. So it needs to be there. The Fed started requiring reporting, but that's only as of May, and that was really after the bulk, so to speak, of the pandemic had passed through New York and New Jersey in our area. So we need to have that data. It's absolutely essential.
And Bill Ferris, you may have heard this from some of your counterparts around the country that different states keep the information differently, and so there's kind of a data question at the national level. But within New York State, are they keeping the right numbers? They did, in fact, when asked about it, I think the administration said that their category of known or suspected meant that it would, number one, take time to figure out what is behind that number of suspected, and that they would, in fact, present the information at some point. But from AARP's standpoint, is that good enough? Are they being transparent enough? Do you think the data exists that we all want to know?
I think the data exists, and I know the legislators on the line today asked that question in great detail. But from AARP's perspective, more transparency, more data is never a bad thing. And from AARP's experience, not only here in New York, but across the country, of course, is that sound policy, good policy, always is based on very good data and talking to people and seeing what is happening on the ground. We didn't know what was happening on the ground with nursing homes. We knew that facilities had deaths. We knew people were being transferred, but that wasn't counted when they died in the hospital. There was never numbers on infection rates of staff or residents in nursing homes. All that information really needs to be found out, needs to be posted, needs to be transparent, put on the internet, on the COVID-19 tracker that the Department of Health has. Because moving forward, as we've discussed, we can't let this happen again. And good policy is always based on good data and transparency. And I think that's what's needed.
Yeah. I'm sure if the health commissioner wanted to know how many people went to the hospital because of food poisoning who came from a nursing home in, pick a month, May of this year, I'm sure the health commissioner could get a report itemizing that and exactly which nursing homes they came from. It could probably be on his desk by tomorrow afternoon because they have that kind of data. They've got the same kind of data for COVID-19, probably a lot more detail. If they're not letting the public know how many people went from a nursing home to a hospital and died because of COVID, they're keeping it a secret because they don't want the information to be public, and they should. The public has a right to know, was it really 6,500 nursing home patients who died of COVID, or was it closer to twice that because a lot of them died in a hospital? And did some of them come from this nursing home as opposed to that nursing home and die? The public has a right to know that too. And that information is being kept secret by the health department.
That's right. And two quick comments, if I may. Number one, we have asked for this information, and the commissioner said that he would provide it, and we are going to hold him to that. We're going to, in the next couple of weeks, we expect for this answers to have the response to us. If it doesn't happen, then, as my colleague said, there is a need to have an independent investigation here. We are going to do what we can as a legislature, and there's conversations that are happening amongst the Senate as well as the Assembly as far as what our next steps are. But we're going to take him at this point. We're going to take the commissioner at his word. He said he would produce this information for us, and hopefully he will.
An independent investigation. Who might lead such an investigation, Senator?
Well, an independent investigation is just that. It can't be the agency. Now, I would say, and I've said this before, and in this, my colleague Dick Godfrey and I have disagreed a little bit, because I believe that we in the legislature have the authority to be able to get more information, and we will look into those options because we do have the ability to be able to subpoena information. We will be, but that is not a decision that I make by myself. It's a decision that happens at the leadership level and with our conference. So we will be assessing the information that is given to us by the commissioner and by the administration, and make a determination of how we best proceed.
Yeah, there's a high level of expertise and investigative skill and quantity of people and knowing what you're looking for that's really needed here. And to me, it's not so much, who should we blame for this or that, but what was wrong with our whole system, and what do we need to fix in our system going forward. I really believe we need to get people from schools of public health and other academic institutions in New York with funding from private foundations, so that no one can say, well, the governor got them to do this, or the Senate or the Assembly got them to do that. I think that kind of group effort in academic circles and foundations is really needed. And again, not just to look into nursing homes, but to look into how our whole healthcare system was prepared for this, how our economy was and wasn't prepared for this. I think we really need a very broad and very professional and very independent of government examination here.
And Errol, just to summarize everything that we discussed about the data. I mean, I think the question is it's not whether they are tracing or tracking the data. It's why aren't they releasing the data? I mean, I think that we can all agree to that. And we know they're tracking the data because CDC has released some of this information already based on the May and June data. And that initial small glimpse show that there is a big gap between what the DOH has released versus what the CDC has shown us in some of these nursing homes. And I personally know how zealous the Department of Health has been throughout this pandemic in pursuing those numbers. When I surveyed, dozens of nursing homes in April and May, the only phone call they got twice a day by DOH was about statistics and data. But we know they have the data. So again, the question is, why aren't they releasing it?
And lastly, just one quick thing that I'd want to make sure that we say, Errol. It would make it a lot better and a lot easier if the governor and the administration were to accept responsibility as opposed to patting themselves on the back. And this is the main thing that we're doing here. I'm big on accountability. And I'm saying to the governor and to the administration, don't be publishing a damn book right now. How about you accept responsibility for the things that happen so that we can make sure it does not happen again? That's what I'm saying.
I remember under close questioning, you sort of pressed, I think it was the health commissioner, as a matter of fact, Senator, saying you seem to be trying to massage the numbers in a way to make the agency look good.
Yeah.
A death is a death, whether it happened in a hospital or in a nursing home. What would be their incentive to be careless about making that information accurate?
Careless is not the word that I would use. It just seems to me that if every other state, first of all, let's go back for a second. The reason we're seeking this information is so that we can make better policy. If we can determine in a more accurate way where the deaths actually came from, it means we can put more resources, we can commit more resources to the places that are most necessary so that more lives are saved. So this is not about blaming anyone. This is about finding the best information possible to make better policy. So I don't think it's carelessness. I think it's purposefulness. The reason why some of this data might not be shared is because of this. And I will continue to press, because ultimately, again, we cannot make good policy unless we have best data. And unfortunately, from the responses or the lack of responses that we've gotten from the administration, it seems that they're trying to massage the numbers so that they can go out and publish a damn book. I will not get over that. I will not get over that. Why are you doing this right now, sir? Do not publish a damn book. Focus on solving the problems. Apologies for the...
No, not at all. Let me...
we've asked the health department, can you tell us how many people went from a nursing home to a hospital and died? And they said, we don't want to release that number because we don't want the deaths to be double counted. Once attributed to the nursing home and again attributed to the hospital. And, they tell us how many people who died in the hospital were male and how many were female. They don't worry when they disclose how many were male, that somehow that's going to be double counted. So to say that we don't want to tell you how many came from a nursing home because we don't want the deaths counted twice is just patently ridiculous. And when you ask somebody a really important question and their answer is patently ridiculous, that suggests that something wrong is going on. And I think it's clear that this is one case where something really wrong is going on.
I mean, I've done a fair amount of university research and worked on investigative projects as a journalist. This seems to me like one of the easiest questions that you could answer, which is just simply say, if your home address is in a long-term care facility, we will deem you to have been registered as part of long-term care facility COVID deaths if you die plus or minus 48 hours, 72 hours, 100 hours after leaving that facility. I mean, that would capture probably 90% of what it is we're talking about. And I'm sure some future researcher is going to apply that kind of a standard. Just say, look, if this was your home address, we're going to just attribute it back to the facility, right? I mean, what other kind of conclusions could you draw?
By the way, if you get shot on the street and they take you to the hospital and it takes 3 months before you die, they attribute your death to the person who shot you on the street, even though you died 3 months later. Duh.
Right. Yeah. Oh, well, okay, we'll see. Let me switch topics, folks. This one is actually a little personal to me. My dad lives in a long-term care facility up in Westchester. We are severely restricted from visiting. We have to make appointments. It can only last for 20 minutes. You can't sit here. You can't sit there. You have to sit outside. A lot of different challenges. We're coping with it. We're dealing with it. We all remember, though, the images of family members looking through a window at their loved ones. We have a long-term care ombudsman. They're supposed to be kind of helping manage a lot of these relationships. Where do things stand now with in-person visitation? What else do we need to do? How do we make sure that this long-term care ombudsman program is effective as we wait for this pandemic to subside? Should we be giving their staffs access to nursing homes in order to do a better job of watching out for the interests of consumers and their families? Let me start with you, Richard Mollett.
Well, thank you. We've been really concerned about visitation. Obviously, we hear about, I would say the biggest things we hear about from families and ombudsmen are related to neglect and are related to visitation. And those two go hand in hand, because I didn't realize until the pandemic hit how much care family members are giving and how crucial their visits are. It's not just sitting down and playing a game of cards with someone, which is nice and important, but providing the care, providing the monitoring, providing the social connection is absolutely critical for people's lives. So where we are right now is the Federal Centers for Medicare and Medicaid Services released guidance about visitation, I guess about a month ago, and the state, released guidance thereafter that for facilities. So essentially what we're seeing is that the state guidance is much, much more conservative actually than the federal guidance is. And in our opinion, it's overly so. As you're telling me you experienced with your dad, the federal guidance is for careful visitation within a facility. But for some reason in New York, we only have the same requirements, 28 days without any cases of COVID-19 in the facility for outside visitation. And as we've been pressing people, especially on the federal level, is that one, this cannot be discretionary, to facilities, because too many facilities, even though they may say they want to have visitation, in fact really don't. Many facilities are very happy not to have anyone coming in their door to see what is going on, no matter how that affects their residents, unfortunately. And then, the visitation should be happening across the board outside. There's no reason not to have outside visitation and not to be taking steps to make that as universal as possible in terms of access. And then having safeguards internally. And very quickly, when it comes to the ombudsman program, we have been concerned as well that we want to make sure that ombudsmen are in there. We also want to be careful. New York, unfortunately, has a heavy reliance in our ombudsman program on volunteers because we significantly underfund the program and are not able to hire enough professional staff to cover facilities. So a lot of those volunteers themselves are older adults, they're retirees, and I would be concerned about them going into nursing homes without a lot of precautions being taking place. So we need to amp up professional ombudsman staff in this in this state. We need to come on board with more funding. It's a really small program in the scheme of things, but it makes a huge impact. I think in terms of resident care, resident quality of life, and being a voice for residents now more than ever.
Okay, you were absolutely right about there being sort of indirect kind of preferences being expressed by the facility. So like in our case, they say, well, you can come and visit if you want, but then he'll have to be quarantined in his room for 14 days or something like that, which is the same as saying don't come, on some level. Bill Ferris, what does AARP think about this?
Well, to expand on what Richard said, we believe the long-term care ombudsman program, which is essentially the voice of residents in facilities, it's underfunded, it's understaffed, and as we discussed, COVID exposed a lot of bad things in our healthcare system and deficiencies. I think COVID exposed greatly the deficiencies in the long-term care ombudsman program. It is a great program, dedicated volunteers, but the program needs help, it needs resources. If you look at some of the numbers in the program, there are well over 600 nursing homes in New York. I think there's close to 1,500 adult care facilities, assisted living, nursing homes, adult board and care. And right now, on a good day before COVID, close to 30, almost to 40% of these facilities never got a visit from a long-term care ombudsman, even before COVID. And the comptroller did a report essentially saying it's a great program, but it needs help. And we agree. And we think that, next budget cycle, there should be more funding for this. I know the governor has a reimagining plan for the long-term care ombudsman program that we're going to participate in, but we need to really beef that program up. And as far as visitation goes, it is one of the biggest complaints that AARP received during the pandemic, of even from staff members and family members of staff members and just all across the board from our membership, is that they cannot contact their loved ones. They are not getting information from their loved ones. And that could have been a good role for the ombudsman if they were allowed in facilities and if there was a beefed up program. But I know the legislature passed some legislation to make sure we have virtual visitation in place. The governor put $1 million towards it. But all that has to be taken into consideration. At the end of the day, people need to contact their loved ones either through Skype or to go visit them in the facility. We just cannot shut down that whole communications process again. We really have to work on that.
Assemblyman Kim, what do you think? More funding for the long-term ombudsman program, or maybe a visitor's bill of rights? What do you think?
Yeah, I think we need to create a separate category for essential care visitors. Other states have taken that on. To make sure that they have a separate status to gain access to these facilities. And I've heard so many nightmares stories from families whose loved ones suffered, even suffering now, losing weight every day because of mental depression, anxiety, and feeling isolated, and feeling like the people who usually come to see them are no longer showing up. And those things do add up every single day for the people who are still in nursing homes. In one story in particular, this woman named Marcella Goen, a constituent that is going through a similar situation right now, where for weeks, she's just trying to get access to her husband, and she's actually filing a lawsuit because she had enough. She wants to have visitation rights. And furthermore, I think what you brought up, the Bill of Rights, is actually very interesting, because as you know, we already have a Bill of Rights for residents. You know, we have a federal statute that we passed in 1987, I believe, and we strengthened that by the state. So what's the point of having all these rights to guarantee and ensure a better standard of care and making sure that they have communication if we can't protect those rights?
One thing that I'll say is that we actually sent a letter in response on this issue, particularly of visitation. We had some ideas about how bad it was, but the hearings, one of the things that it did is that really gave us a sense of how terrible the situation was for certain populations. Certainly the stories that we heard about children in nursing homes for children and their lack of visitation by parents, certainly it was harrowing stuff. So we actually sent a letter that was made public just today, if I'm not mistaken, that was actually co-signed by all the chair people who were part of those hearings, saying to the administration, hey, you can do something administratively right now, because certainly there are things that we're looking legislatively to do. Matter of fact, just this morning, the same chair people in the Senate who chaired the committees, both Senator James Skoufis, Senator Rachel May, and myself, we had a conversation to start kind of brainstorming about some of the legislative ideas that the hearings gave us. But the fact is that the governor can do this right now. There is a change in policy that can happen from 28 to 14 days. And we know that folks that are visitors still would have to put on the PPEs and still follow all the safety precautions, but they're willing to do it. These are family members who care deeply about the folks who are in nursing homes, and they are, as has been said before, essential to their care. These are not just visitors. These are their parents. These are their children, folks who are important to these folks maintaining their mental stability. And for that, we want to make sure that there's policy that changes. Hopefully the governor can do it before legislation is necessary.
Does Dr. Zucker share that view that this is part of essential care for folks to be able to receive regular visits? Did that come up during your hearing, Senator?
It's a conversation you're going to have with Dr. Zucker.
I'd say if he shares that view, he needs to make sure his department shares that view and implements it.
Precisely.
Mm-hmm. Okay. Okay, folks. There's a lot of talk about a second wave of COVID-19 hitting New York. As impressive as the numbers are, as far as new cases, there is this possibility. There are related complications, in fact, when the so-called regular flu season arrives in October, where there'll be a fair number of people who have symptoms that are indistinguishable from COVID-19. What are you, what do we need to do to make sure that our long-term care facilities do not run into a secondary crisis in a few weeks from now? It's really, the time is really right upon us. Let me start with you, Mr. Mollett.
Thank you. Number one is we need to make sure that they have sufficient staffing. I mean, it's the lack of staffing. It's people that are rushing around, the care staff rushing around, trying to care for 15, now it's 20, sometimes even 30 residents at a time. It's utterly impossible to do that safely, and too many facilities do that as a matter of course. So we said this at the very beginning, again, after we saw what happened in Washington, we urged facilities to amp up their staffing, but the state has a lot of control here. We can cite facilities, we can stop them from admitting new residents until they get their staffing up. And I think this pandemic has made clear that facilities are not an appropriate place for people to go for post-COVID recuperation. Or certainly not when they have COVID either. We need to again be taking more care to cohort. And then secondly, the Trump administration is sending out testing equipment to all the nursing homes. It's in the process of doing that. It should be done by October, I think, is their deadline. They're not the best tests, but they're tests nonetheless. So that will be helpful. And we need to make sure that facilities have adequate PPE. I think that the standard would be about 90 days of full-on PPE for a staff and for residents and of course visitors.
Okay, Mr. Ferris, is this it sounds like a pretty hefty agenda we just heard outlined. Is this something AARP is going to be pushing for?
We need a plan. We need a long-term care plan. We need a long-term care strategy that not only looks at nursing homes but looks at home care and involves caregivers. I mean, it's been said in New York and across the country, the caregivers are the backbone of the long-term care system, not only here in New York, but across the country. We need to involve caregivers in this process. And essentially, we need to coordinate all the parts of the long-term care system together. And I know Mr. Senator Rivera's colleagues passed the bill sponsored by Senator May, the aging chair, to really bring together the stakeholders to look at developing a plan, look at how we can do this. I know the Assembly, I believe, is committed to looking at that issue. But in the meantime, today, as people have said, today the governor could coordinate a long-term care task force. We've asked him to do that. He could do that today, pull everybody together and start developing an overall comprehensive plan for the long-term care system in case there is a second wave. So we think essentially at the end of the day, we need a plan. It needs to be developed and executed.
And to the legislators, this all sounds like disaster preparedness, where you get ready because you see a hurricane making its way across the map. What's the status and what's the likelihood of there being a plan in place as we get into the new flu season?
There's two quick things that I'd want to mention. Number one, we certainly need a plan for the immediate, but we also need to have a long-term commitment. When the governor talks about transforming the healthcare system, it seems that he's doing it for a soundbite, and it's a nice one, but there needs to be some commitment behind that. There needs to be some actual action behind that. That means either as it relates to long-term care or the healthcare system as a whole. If we're going to reimagine this system, let's make sure that we do it with people at its center, not profit at its center, and have be a long-term conversation, which is why the New York Health Act is so essential. And I think that my colleague, Dick Gottfried, might have a couple of things to say about that as well.
Yeah, well, what we need to do to prepare for a second wave is also exactly what we need to do to prepare, even if there isn't a second wave, just to be prepared for a return to normal times. And that's staffing and quality enforcement, better visitation policies, all the things that we talked about, getting the ombudsman program more fully engaged. One thing that all these things have in common is that they don't happen for free. And New York has to recognize that. The governor often says, and he's right, that we shouldn't be putting a price tag on human life. But that is exactly what we are doing in connection with nursing homes and in connection with a lot of other areas of our healthcare system. And we have to confront that.
I agree with all my colleagues and everyone on the panel. I just want to add two quick things, especially the New York Health Act. I think that everyone can agree that they can resolve everything today if a benefit system is universal and single payer is in place. But also making our benefits in the meantime a little bit more flexible would help. Especially people who during this pandemic wanted to take their loved ones outside back home from nursing homes, couldn't do that because they couldn't afford to pay for home care. If our benefits, the Medicaid and Medicare system that are reimbursing these nursing homes between $300 to $700 a day could easily transfer some of that to home care during times of emergencies, I think it would have helped a lot of working families during this crisis. So that's something that we should be looking at as well.
Will that get due consideration? That sounds like an actionable plan that actually has some funding behind it, which is pretty rare in Albany, right?
Well, strengthening home care in New York has been an agenda of the Assembly and Senate for a long time. But like anything else that involves putting money into something, we always get enormous pushback from the executive branch. And they've got a disproportionate share of the power when it comes to the budget. So that's something we're going to have to really push forward on.
Okay, you all have given us a lot of food for thought. I want to thank each of you for participating. Ron Kim, Dick Gottfried, Senator Gustavo Rivera, Richard Mollett, and Bill Ferris. Let me turn it back over to Beth Finkel.
Great, thought-provoking conversation. Thank you so much, Errol. Thank you to J.P. Miller and the Empire Report for hosting this session, and for all of you for watching. If the legislature does return for a special session this fall, AARP certainly hopes the Assembly will give the final legislative passage to a bill that would create a long-term care task force to examine the state of long-term care. You heard that so much through this conversation, both home-based and facility-based, and consider potential models for improvement. We at AARP believe that such a task force should also examine the staffing levels and any possible supply chain issue for personal protective equipment, PPE, in the future. This bill, which is S8633/A10836, is sponsored by Senate Aging Committee Chair Rachel May and Assemblywoman Catalina Cruz. It has already passed the Senate. AARP also strongly hopes the legislature will fully restore the rights to families for those who have died in nursing homes during the pandemic, to hold nursing homes accountable for abuse and neglect. The governor and our lawmakers should completely and retroactively repeal the broad legal immunity they granted to adult care facilities. So thank you. And now back to JP.
Wow, what an excellent panel. Thank you so much for watching. I want to especially thank our moderator, the best in the business, Errol Lewis. I'd like to thank our participants, Senate Health Committee Chair Gustavo Rivera, Assembly Health Committee Chair Dick Gottfried, Assembly Member Ron Kim, Bill Ferris, and Richard Malott. I'd also like to thank AARP New York for sponsoring this event, and to Beth Finkel. For more information, please check out aarp.org/NY or empirereportnewyork.com. Thank you again for joining us.